Hello, and welcome to today's conversation about innovating for behavioral health. My name is Maura Little, and I am the Executive Director of Cambia Grove. Cambia Grove is a division of Cambia Health Solutions and serves our communities as a healthcare innovation hub focused on removing barriers to support the advancement of impactful healthcare innovation. There are many barriers preventing healthcare innovation from taking root. One of those barriers is simply the opportunity for entrepreneurs to connect and learn from individuals who work in the healthcare system. Our Trails competition works to solve for this disconnect by providing promising startups access to real-world feedback. Past winners have been embedded into the system, spending weeks job shadowing to better understand how solutions can integrate into the current workflow. Other winners have been linked into the community to strengthen cultural appropriateness and the ability to serve diverse populations. When we formally launch our 2021 Trails competition this fall, our competition will focus on behavioral health. We know there is an incredible need in behavioral health, and these needs have only been accelerated by the pandemic. Joining me today to discuss how innovations can better support behavioral health is Cambia Health Solutions Chief Medical Officer, Dr. Marion Couch. Marion, it's great to have you here.
Thank you, Maura. Pleasure to join you.
So let's get started. First, I've had the opportunity and pleasure to get to know you over the last couple of months. For our viewers, tell us about yourself and your role at Cambia.
Thank you. I am not only the Chief Medical Officer at Cambia, but also the Senior Vice President of Healthcare Services. And that spans our 4 regions, Blue Cross Blue Shield plans, and also the greater Cambia company. I get to work a lot on strategy. And so this is where the behavioral health strategy falls into my lap and with my wonderful team. So happy to join you. This is an area of intense focus for us. And in fact, when our CEO, Jared Short, goes and meets people out in the market, this is one of the things that is always brought up with him. It's really front of mind for so many people.
Yeah, absolutely. And you have a long career and long history in healthcare and services.
Yeah. So I'm a trained surgeon, but I've worked in medical groups for almost 15 years as a senior executive. And I was chairman of 2 surgical departments and practiced. I really spent over 30 years practicing. Most recently, I was at the Centers for Medicare and Medicaid Services as the senior medical advisor in the office of the administrator. And there we were making policy decisions for that $1.3 trillion agency. So it was quite a wonderful experience. But they're struggling with how to address this big surge in mental health and behavioral health needs as well. So it's something that's as pandemic as the pandemic. It's all across the country. And I'm sure we'll get into it, but the pandemic, unfortunately, has just laid bare the problems with it. It was something that was just a huge issue before the pandemic. And now it's just become even more pronounced, and it's something none of us can ignore. So it might be a moment for great innovation, to be honest, Maura.
Fantastic. So as I mentioned, this year's Cambia Grove's Trails competition will be focused on behavioral health. From a basic 101 level understanding, can you please explain the difference between mental health and behavioral health?
So I think I mentioned that I'm a trained surgeon. So, I try to stay within my lane, but there's a great reference, and it's with the Health and Human Services Department, and it's called mentalhealth.gov. So mentalhealth.gov is a great website for you. And the way you might want to think about it is behavioral health is a big umbrella, and it covers the promotion of mental health, resilience, and well-being. So it's the way in which our habits impact your well-being. So that's eating and drinking, and choices you make about exercising and your addictions. And mental health is really the intersection of family health. You have a family history, and then you have a brain chemistry, and then you have life experiences. And those all weave together and determine how you make choices, how you handle stress, and how you relate to others. And often mental health, again, as a section under behavioral health, often carries a diagnosis with it. So again, well-being might be something we consider when we talk about behavioral health. And then with mental health, it's often thought of as a diagnosable issue that is often mild, moderate, or severe.
Interesting. So for behavioral health, the factors that go into behavioral health must be pretty broad. Are there few key factors that innovators in the space need to really pay attention to?
I would think that helping people with resilience and well-being is where they might want to focus. And that sometimes is a group that we call the worried well, but there's nothing wrong with being the worried well. So thinking about how to help people always improve their well-being and their resilience is something that every single person that I could imagine, every single person should do. So if you're an innovator, that might be a great place for a virtual app. There's an article today actually in one of the popular news feeds I get, and there's 20,000 apps for behavioral health. So there's great innovation in this area, but for many of us, trying to find out a way to seek out better well-being and better ways to cope with things is something that every single American could use. So that might be an area where you have a huge audience, potentially a huge market share.
Yeah, but with 20,000 apps, I mean, that's a pretty crowded space. The
need is great though, Maura. The need is great. I think that's in response to this incredibly great need. And I know we're going to go into it, but it's just phenomenal. It's just really impressive, the great need we have in this country for help with behavioral health.
It reminds me of the word I just learned yesterday. One of my colleagues brought it up, is languishing. And there is another great article about putting a name to it. Does that fit somewhat into this?
I would think so. And it's not part of it. Often we think of it as a social determinant of health, but if you think about it, if you're lonely or you feel isolated, that's part of your well-being as well. So there's overlap in a lot of this. And so ways to address all of those things. I hadn't heard languishing, but it seems like a great term for this. And many of us were languishing for weeks and months. And I hope that is ending as we come out the other end of this pandemic.
Absolutely. So let's talk about the need. Before the pandemic, we, as a healthcare community, really recognized a need. Pandemic, fast forward, we're a year and more into the pandemic, depending on where you started geographically. The healthcare community, where are we as a healthcare community in terms of meeting the needs of behavioral health services? And I guess the follow-on question is around the 20,000 apps that are already available. So where are we with meeting that need with so many different variations?
So let me start with where you ended. And I think what I'm about to say will paint the picture that none of this is easy. And addressing someone's needs are not going to be maybe addressed by one app. So innovators are really going to need to understand that there's a spectrum of care. They're going to need to understand the nuances of getting that care and how to keep people healthy. And so an app it's not a one and done. So I think that's important. But let me read you some of these statistics that our experts at Cambia shared with me. And again, we have medical directors who are trained in mental health and our psychiatrists. But prior to the pandemic, 1 in 5 American adults had a diagnosable mental health illness, 1 in 5. And 1 in 25 Americans have a serious mental health illness. Only 43% of them got treatment.
Only 43% of the 1 in 25 got treatment.
Oh, of anybody who has mental health treatment, correct. But especially the serious mental health issues, those with mental health issues. The delay in getting care when you're referred is not 10 weeks, not 10 months, but 10 years. And this is from the NIH. This is data from the NIH. We have a 10-year lag in somebody making referral and then getting the care they need. And if you have a diagnosis, for instance, of an anxiety disorder, only 20% of people who receive a diagnosis of an anxiety disorder will get treatment that same year. And of those who get a diagnosis of a mood disorder, only a third of those will get treatment that same year. That's how dire the situation is. We have, for instance, in the Pacific Northwest, we have a very high prevalence of mental health illness. And unfortunately, we have the lowest number per population of providers of any type of mental health and behavioral health providers. And those aren't problems that are going to be easily solved. It doesn't easily lend itself to correcting by training new physicians and new psychologists and other experts. It just takes a long time, and there's not a program in place to address that right now. So we're facing a baseline 10-year delay in getting care. And then looking at Cambia data, Maura, we've got a 35% increase from the pandemic, during the pandemic, of behavioral health claims, meaning there's a huge, more than any other specialty, there's a huge increase in the number of people seeking care during the pandemic. For a country, this means that you have about $300 billion in avoidable expenses because we're not properly caring for our fellow Americans. And sadly, for instance, suicide remains the 10th leading cause of death, with about 43,000 per year. And the data coming out, which I can't speak to in detail, but it's being published about younger people bearing the brunt of that, is really just soul crushing. But the numbers are striking and they're rising, and we're not able to effectively address it. So when we also look at our claims data, for instance, which is a way to look at our members, behavioral health is one of the most prominent chronic conditions that we get. You know, it's a tremendous number of our members will have these issues, and they're ongoing, they're enduring. And so it's, again, not one and done. It's not one app and people move on. It's going to take a really concerted effort to treat all these folks and get them feeling better.
Yeah. So you touched a little bit on the barriers around access. Can we dive in a little bit deeper? So it's 10 years on average. That's quite a bit of time.
Yeah.
What are some of the barriers here that are contributing to that wait?
In the pre-pandemic, we had people struggling with getting access to a provider. And then you often had to get up and leave your office or work and drive there and wait in an office and then drive back. So access and time to travel, and there is tremendous stigmata. There's a stigma to getting care, and it's hard to overcome. We're seeing now, thanks to the pandemic, an incredible acceptance of telehealth, and it seems to be beautifully suited for behavioral health visits, virtual visits. It seems to be a great solution. So we're seeing the stigma drop, and we're seeing, for instance, more men seek care. We're seeing more people over 65 seek care, and more people who have Medicaid rather seek care, which is great. We're seeing an increase in women who are having more issues with alcohol and substance abuse, and we're hoping that maybe they can help seek care this way. But one of the silver linings, and I say that, and I don't take lightly the devastating effects of this pandemic, but one of the silver linings is that we know now that behavioral health is perfectly suited for this. So I think access and stigma are two areas that are really going to be helped by the telehealth and being able to do virtual care and reach someone via a program or a platform, and have that help us with our high prevalence and low number of physicians and other healthcare providers in the area. Cost is also an issue for folks, but we're finding that the good news is a lot of health systems and payers understand the importance of it. I'm going to tell you a story. It's a little tangential, but I never forgot this. While I was in Washington, we were working on another project. For instance, we're trying to figure out how to get appropriate care for people who have chronic pain, such as knee pain. And we met with this incredibly prominent surgeon, and he was advocating for behavioral health, weight loss, all sorts of people in a healthcare team that could address issues with pain. Because he said to me, Marion, I'm so tired of replacing knees for people who are depressed. So you were really coming to understand, even surgeons, that a lot of what we do is not because a person has a problem, it's because they have another issue. And a lot of it's behavioral health. And, so depression is an example of that. And so if we could adequately treat a lot of people for depression, they might find other ways that didn't require a surgery, because it's so discouraging to do all these other things and still have the underlying root cause still there. So I would opine that a lot of payers are understanding the importance of treating behavioral health and want to treat it, because we understand we're probably paying for a lot of unnecessary care because we're not addressing it. So I would say in the past, I think 2 or 3 years, a huge understanding of the importance of behavioral health and thinking of a person in a comprehensive way. So I do think this is a silver lining in a way.
That is fascinating. I wonder if there are, and the answer might be no, but if there are studies, you said that they're around the cost of delaying behavioral health due to the we're all one human. So how does that translate into what might be impacting you moving forward?
I think there must be, I can't cite them chapter and verse, but it's hard to get up sometime and go out and exercise and eat well and make good choices when you're not feeling well, when you're struggling. It's hard. And so I'm sure there are studies on that, but it is contributing in my mind to a lot of waste. And the saddest thing is people are falling through the cracks. That's, I would say to innovators, if you're going to innovate in this area, have a way to show me as a payer, you're not going to let my members fall through the cracks, that you're going to help me make sure we've got line of sight in our offering them choices and assistance with getting the care that they need.
Yeah. It reminds me also that the story reminds me of two trails competitions ago. We partnered with the World Congress, and we did a physician burnout focused trails competition, and we had plenty and amazing technology come and apply about how to streamline the electronic medical records and how to reduce clicks and so on. The actual winner of the trails competition was a solution that prevented people from entering into the ER. And so it was about how do you reduce the pipeline. Mm-hmm. So for those watching interested in trails competition, please take special note of Marion's comments around sometimes we're not just looking, sometimes there's an upstream solution maybe.
Yep.
Perfect. Let's dive into one of your last comments about innovators who want to work with payers. As you've worked with many innovators in the past, what are some of the components of startups, of entrepreneurs that you've seen who are successful in getting their project rooted?
So, Maura, let me start by saying we need innovation in this area. The need is great, and don't worry about the 20,000 apps. Again, there are parts of it, and a more comprehensive solution. Innovation is something that will save us, to be honest, and we're not where we need to be. So keep on innovating. For me, it's important to convey to folks that want to think about helping with great solutions. You've got to demonstrate a return on investment to, for instance, if you're going to try to partner with us, and things such as patient activation, patient engagement, just don't work. I can't demonstrate an ROI. There's validated measures, there's validated surveys and questionnaires that will truly help me understand if our members are getting better. I think member outcomes are important, and that often is their satisfaction, their voice. Did I get the outcome I need? It's not exactly the same, but there's patient-reported outcome measures. But these are always good things so that we can talk about the return on investment, because at some point as an innovator, you're going to have to show that. Reduced ER visits, emergency room visits, reduced admission and readmission to the hospital. Again, and making sure the voice of the member/patient is there so we can understand that they're feeling better. They felt the impact of it. So again, validated clinical measures are important. To do that, you're probably going to need to work with an expert, a medical expert that helps you design. For me, if you're going to innovate, we're going to want to pay for innovation in delivery of healthcare. So make sure that healthcare delivery innovation is solid, has metrics with validated outcomes that we can map off of. And I think that's really, really important. And we're going to really want to make sure that there's safety and, again, good member outcomes when we think about assessing and looking at the return on investment. And safety sometimes requires you, when you accept the responsibility of innovating and offering a solution in healthcare, that you have line of sight on that member, and you're not going to let them fall through the cracks. In other words, it doesn't help me if I give you a panel of members to help get to care and 50% of them fall to the wayside. I need to worry about those 50% that fall to the wayside. And so these are really, in my mind, really important members that we lean in on, and really important members to keep engaged. So I hope that that group of pieces of advice will help people as they think about the way we look at innovators and we look at products.
Absolutely. We're about to close out. Any other last words or advice for people watching?
So you were kind enough to say I've been doing this a while, and I have, over 30 years. It seems crazy, but it's true. I've never seen a moment of innovation like this. I've never seen it. The pandemic has just made everyone think about things differently. And we were sort of stuck in a rut. And I think now we're not. So go innovate. I don't think you'll ever see a time like this again. I don't think I'll see a time like this in my lifetime. This is it. So it's a moment of tremendous innovation. We're looking for new ways of doing things. And virtual is one of them. But think outside the box, talk to smart people, gather different voices. It's a time like none other that I've ever experienced.
Fantastic. Marion, thank you so much for joining me to share your expertise in this field.